Hi, my name is Patrice Rimbey. I'm an assistant teaching professor of nursing at the Penn State University Schuylkill campus. My project is titled Improving Nurse Perception of the Perioperative Bedside Handoff. Today, communication breakdowns are a primary source of avoidable adverse events that patients experience. With every transition in care, when patient data is conveyed from provider to provider, a high-risk period for communication breakdown may occur, with information being misplaced or misunderstood. A causative factor in adverse events and sentinel events is a lack of adequate handoff communication. Examples like wrong site surgeries, delays in treatment, falls, and medication errors can be found in the Joint Commission's Sentinel Event Database. A patient handoff, very simply, is defined as the transfer and receiving of a patient care obligation reached by using communication effectively. By implementing a handoff process that is standardized, perioperative nurses can improve the safety and reliability while decreasing the risk of harm to patients. The development of a standardized patient handoff involves patient participation and has been shown to increase the accuracy in communication between providers. In this project, a non-experimental pre- and post-test design was used to measure the nurse's perception of the current handoff communication process. All participants received a pre-survey, an educational component, completed a bedside handoff, and then a post-survey. The nursing assessment of shift report is a 17-question instrument that was used for both the pre and post survey. The instrument used a 5-point Likert scale ranging from 1, strongly agree, to 5, strongly disagree, and was developed to measure nurse perceptions of report. A convenient sample of registered nurses working in the pre-op and intra-op units in an acute care facility in northeastern Pennsylvania was used. Participation was voluntary, and participants could withdraw at any time. The theoretical framework used in this project was Lewin's theory of change, developed by Kurt Lewin, who is the father of social psychology. It is a 3-stage change model referred to as unfreezing, change, and then refreezing. In this model, prior learning is discarded and then replaced. In reviewing the overall summary of findings, the Wilcoxon rank sum test results revealed a significant difference in the pre and post nurse perception of handoff. There was a statistically significant positive difference for one item. Report is an effective means of communication. This indicates an improvement in nurse perception of report or handoff as an effective means of communication. In conclusion, based upon the findings from this study, it is important that education about periop bedside handoffs occur among periop registered nurses. The data revealed an overall increase in the perception of a standard periop handoff among periop registered nurses working in the pre and intra-op areas. It would be beneficial to provide additional education and allow time for nurse participation. This would allow for additional follow-up to identify an increase in any of the other 17 questions on the post survey. It would also help to further measure nurse perception of the handoff. Thank you for your time.